Okay, so you're getting Miss RW today?
Okay, yep.
Okay, so RW is a 31-year-old female coming from home. She presented to the ED with severe left lower quadrant abdominal pain. She also complained of severe nausea and vomiting. She rated her abdominal pain about a 7 out of 10. No known allergies, no surgical history. Previous health history includes IBS and recurrent UTIs.
Okay.
She does have a pain rating today of about a 5 out of 10, so I repositioned her for comfort. But for severe pain, she does have an order for PRN hydrocodone, and that can be given every 3 hours. Elsewhere, she has no edema or tenderness palpated. Heart sounds were clear. S1 and S2 heard. Lung sounds were clear and bilateral. She can ambulate independently. No wounds or pressure ulcers noted. She does not use any assistive devices, such as hearing aids or glasses.
Okay.
And the doctor discussed using CT, abdomen, pelvis with contrast on her tomorrow morning just to kind of see what's going on in the intestines.
Okay. And when did you say she was admitted?
She was admitted yesterday.
Okay. Okay, thank you.
Thank you.
Poppy is the nurse, and she's going to introduce herself by knocking, washing her hands, and introducing who she is. She will also look at the patient and check for name and date of birth on their wristband and check with the MR.
Knock, knock, knock. Hi there, I'm Nicole. I'm going to be your student nurse today. I'm going to go ahead and do a head-to-toe assessment, but let me wash my hands first. So I come over and wash my hands. I'm going to come back. Can you please tell me your name and date of birth?
Rochelle Williams,
Okay, and your date of birth?
11/18/87.
Okay, and I'm going to check that with the MRI number on my computer.
After Poppy identifies the patient, she's going to assess pain, vitals, and orientation of the client.
Okay, Miss Williams, can you tell me where you are today?
I am in the hospital
Okay, can you tell me why you're here?
for abdominal pain.
Okay, and can you tell me what year it is?
It's 2018.
Okay, and you said you were brought in for pain.
Mm-hmm.
Can you show me where you're having pain?
Oh, it's right here on my
Right there, okay.
left side.
How would you rate that pain on a scale of 1 to 10, 10 being the worst pain you've ever felt?
At 8.
8, okay. And how would you describe that pain? Sharp, stabbing, dull, pressure?
Sharp.
Sharp. Okay, and does anything alleviate that pain or make it worse?
Yeah, when I try to get up and use the bathroom, it gets worse.
Okay, does anything make it feel better?
No.
Okay, I'm going to go ahead and assess your vital signs. So I'm going to go ahead and take your temperature. Can you lift up your tongue for me? Okay. Okay, 98.7, I'll go ahead and document that. Okay, and I'm going to check your blood pressure. I'm going to go onto this side so I don't hit your IV. Okay. So 122/70 is your blood pressure. I'm going to assess your pulse. And I would also assess breathing at this time, but I'm not going to tell the patient because it makes it easier for her to not know that I'm doing it. And I will do this for 1 minute.
At this time, Poppy is going to assess the IV location, gauge, and if it's clean, dry, or intact. We would also assess oxygen saturation at this time if we had the pulse ox.
Okay, so I'm just going to look at your hand. So your IV is in your left hand, 20 gauge needle. It's clean, dry, intact with a transparent dressing. Do you have any pain at this site?
No.
No pain at all?
Mm-mm.
Okay, I'm just going to feel up the arm just a little bit. No pain?
Mm-mm.
Okay.
And at this time, she would flush it if this was a patent IV. Now Poppy is going to assess head, eyes, nose, mouth, and neck.
Okay, Miss Williams, I'm going to go ahead and check your head. Is it okay if I touch your hair?
Yes.
Okay, so I'm just going to put some gloves on. Have you had any recent head injuries?
No.
Any complaints of a headache?
No.
Okay, so I'm going to look through your hair, and I'm assessing for bumps, bruises, lesions. I'm also looking for lice. strain up for me. I'm gonna assess the nape of the neck. I'm looking for scabies here as well. No pain with any of this
No.
on your head? Okay. Okay, so I'm gonna dispose of these. I'm gonna put some new gloves on. Okay, so I'm gonna assess your face. I'm looking for symmetry. Your nose is midline. Okay. Can you smile for me? Okay. Do you wear contacts or glasses?
No.
Okay. Do you have any vision problems at all?
No.
Okay. So I'm just gonna look in your eyes. I'm just gonna pull the lid down. Looking at the conjunctiva. Okay. Okay. A little pin light. Do you have any nose problems? Have you ever had any nose surgery?
No.
Okay, no problems breathing? Okay, so I'm just gonna look up your nose. If you could tilt your head back just a little bit for me. Okay, I'm assessing the nares and the mucous membranes in there. Okay. I'm gonna assess your mouth. Are these your teeth?
Yes.
Okay. Do you have any pain in your mouth, anything like that?
No.
Okay. Can you stick your tongue out for me? Open your mouth. Okay, I'm assessing the teeth, the mucous membranes. I'm looking for any kind of sores. So it is pink and moist, your lips and your tongue. I'm gonna look in both of your ears. Do you wear hearing aids?
No.
Okay. Have you ever had surgeries on your ears?
No.
Okay. So I'm just gonna look at them. I'm assessing for drainage. I'm also assessing the skin while I'm looking at the entire face. Okay. No abnormal drainage. I don't see any bumps, bruises, lesions, or anything like that. I am gonna feel on your face. I'm just gonna see, let me know if you have any pain on your sinus points. You have any pain here?
No.
You have any pain here?
Mm-mm.
Okay. I'm gonna feel on your neck. So I'm just gonna feel for your lymph nodes. See if you have any swollen ones. I'm also gonna assess your carotid.
When Poppy is assessing the carotid, she is going to do it one at a time and not bilaterally.
Okay. Do you have any pain or discomfort right here?
Mm-mm.
Okay, and I'm also gonna assess your trachea. Can you look straight ahead for me? Okay, it is midline and not deviated. Okay, and I'm gonna come to the end of the bed. Can you turn your head to the side for me? Okay, and to the other side. Okay, I'm assessing JVD here.
At this time, Poppy is going to assess cranial nerves 2, 3, 4, and 6. We cannot assess 2 at this time, but you can assess it with visual acuity using a Schnellen or Rosenbaum visual acuity chart.
Okay, so I'm just gonna go ahead and assess your eyes right now. If you can look straight, keep your eyes on the pen and do not move your head, but follow the pen light. Look
Okay.
straight for me. Okay. Okay, very good. And if you can keep looking at the pen, and I'm going to bring it a little bit closer to your face, just follow it for me. Okay, good. I'm going to go ahead and shine the light in your eyes, but it won't be very long. So I can go ahead and dim the light at this time just to make it a little bit easier for me to see. So I can dim the light. If you'll just look straight ahead for me. I'm checking consensual response and seeing how the pupils dilate. And I will check both eyes. Okay.
Poppy is now going to assess cranial nerve 8 acoustic. She is going to do this by assessing her hearing.
Okay, Miss Williams. I'm just going to make a noise back here. Tell me when you can hear it, okay?
Okay. Hear it.
Okay.
Hear it.
Okay.
Hear it. Hear it.
Poppy is now going to assess cranial nerve 1 olfactory, and this is sense of smell.
Okay, can you close your eyes for me?
Mm-hmm.
Okay, I'm just going to have you smell something, and you can tell me what it smells like, okay?
Mm-hmm.
Okay. Smell this for me.
Mm-hmm.
Do you know what that is?
Yes, alcohol.
Poppy is now going to assess cranial nerve 7 facial, 10 vagus, 11 accessory, 12 hypoglossal.
Okay. Can you open your mouth one more time for me? And stick your tongue out. Okay, good. And can you swallow for me? Okay, did you have any problem with that? Any pain?
No.
Okay. And your speech is clear.
Yes.
Can you raise your eyebrows for me? There you go. Okay. And can you give me a smile? Okay, I'm just checking for symmetry. Okay, can you raise your shoulders up for me? Okay, very
Poppy
good.
is now going to assess trigeminal nerve, which is number 5, and number 9, glossopharyngeal.
Okay, can you open your mouth for me, please, and say ah?
Ah.
Okay, can you stick your tongue out for me?
Ah.
Can you also raise your tongue? I'm gonna assess underneath your tongue at this point. Okay, good. And can you clench your jaw together? Okay, good.
Poppy is now going to assess heart sounds.
Okay, Miss Williams, I'm just gonna go ahead and inspect, and then I'm gonna listen to your chest, okay? I'm listening to your heart.
First is aortic, second intercostal right. Pulmonic, second intercostal left. Herbs, third intercostal left. Tricuspid, fourth intercostal left.
Okay, can you please raise your breast up just a little bit for me?
Mitral, fifth intercostal, midclavicular left. And then she's going to listen to the apical pulse for a full minute.
Okay, I'm gonna listen for 1 minute.
Poppy is now going to listen to lung sounds. There are 6 locations on the front and 8 on the back.
Okay, Miss Williams, I'm just gonna go ahead and assess your lungs. Again, I'm gonna use my stethoscope. Just breathe normal for me.
Okay.
For the purpose of the video, we will be keeping the patient covered, but in a clinical setting, you would want to place your stethoscope underneath their gown to listen better.
Okay, Miss Williams, can you please sit up for me? I'm just gonna listen to your breathing on the back. At this time, I'm also gonna be assessing your back for any bumps, bruises, lesions, or anything like that, so I'll assess your skin as well.
And again, there are 8 places on the back. Poppy's going to assess the upper extremities, looking for any breakdown, tenderness, edema, skin turgor. She's going to assess pulse, cap refill, range of motion, grip strength, and reflexes.
Okay, Miss Williams, I'm gonna go ahead and assess your arms. So I'm just gonna be looking and feeling on you just a little bit.
Okay.
So I'm gonna assess the skin. Okay. It is clean, dry, and intact, so that's good. Okay, it's good temperature. Can you squeeze my fingers for me? Okay, squeeze them as hard as you can. Very good. Can you put your arms out to the side? Okay, no pain with that. Okay, and out to your front. Okay, very good. I'm gonna assess your pulses, so you can just relax.
She's assessing brachial,
Okay, so they're equal and bilateral, +2.
and she's assessing radial.
Okay, also equal and bilateral and +2. Okay, I'm just gonna pinch on your skin just a little bit to assess your skin turgor.
This is assessing for dehydration.
Okay, I'm gonna do the same as well. Okay, and I can also assess this right here. Okay, very good. I'm gonna squeeze on your fingers to check your capillary refill.
This is assessing for circulation.
Sometimes if they have nail polish, I can turn it over and squeeze on the inside of the finger to assess it as well. So I'm just gonna do the outside. Okay, very good. Can you push against my hands for me? Very good. And then pull towards you. Okay, well done.
Poppy is going to assess GI and GU. GI, she will listen and then palpate. And for GU, she's looking for any abnormalities with urination and anything with reproductive organs.
Okay, Miss Williams, I'm gonna go ahead and assess you right in this area, okay? So I'm gonna lower the head of your bed down so you can be flat. Can you tell me when your last bowel movement was?
This morning.
Okay, can you tell me the consistency and what color?
It was brown and it was solid.
Okay, and that's normal for you?
Yes.
Okay. Have you had any nausea, vomiting lately?
A little.
Okay. And have you had any recent weight loss or weight gain?
None.
Okay. So first I'm just gonna look at the abdomen. I'm gonna look for distension. I'm also looking at the skin integrity of the abdomen. Okay, there's no distension. I'm gonna go ahead and listen now.
And for video purposes, we do have Rochelle in her clothes, but in the clinical setting, you would lift up the gown and inspect the belly without any clothing.
Okay, so I'm gonna start at the ascending colon. Okay, so active bowel sounds. And I'm working up to the transverse colon. And then down the descending colon.
And you always auscultate before you palpate.
Okay, active bowel sounds in all 4 regions. And I'm gonna palpate now. I'm gonna feel for any lumps in the abdomen, any rigidity, and let me know if you have any pain with this, because I know you had pain up in this area, okay?
Okay.
So let me know. You have any pain with this? Any pain here?
Right there.
There? Okay. Can you rate that pain again for me?
Now it's at a 7.
A 7? Okay. And is it still the sharp, or has it changed?
It's sharp.
Okay. And when's the last time you ate something?
I had breakfast this morning.
Okay. But did that make it worse?
It did. It made it worse.
Okay. Okay. Okay, so I'm just gonna assess your private area down here, but I'll keep you covered for privacy. When's the last time you went pee? When's the last time you urinated?
I would say this morning.
This morning? Okay, can you describe the color for me?
It was yellow.
Okay. Did it have any odor?
No.
Okay. Do you have any pain when urinating?
No.
No discomfort?
No.
Okay. Have you ever had any children?
No.
Okay. And when's the last time you had your period?
About 2 weeks ago.
Okay. And was everything with that normal for you?
Yes.
Okay. Do you practice safe sex?
Yes, I do.
Can you tell me how you practice that?
I use condoms.
Okay. So I'm just going to take a look to make sure everything's normal. Okay.
Poppy is assessing for if the genitals are intact, and she will chart this.
Okay.
Go.
Okay, Miss Williams, do you ever do self-breast exams?
Yes, I do.
You do? Okay, can you explain to me how you do those?
Oh, I do them like once a month right after my menstrual cycle.
Okay.
And I just put my hands behind my head and move in circular motions around this area.
Okay, and you're feeling for any bumps or nodules or tenderness?
Mm-hmm.
Okay, thank you very
Poppy
much.
is now going to assess the lower extremities for any breakdown, edema, tenderness, cap refill, temp, pulses, and range of motion.
Okay, Miss Williams, I'm going to go ahead and assess your lower extremities. I'm going to pull this down, but I'm going to ensure that we do still have privacy in the room. Okay. At this time, I'm going to feel your femoral pulse. Okay, and I'm assessing your skin for any breakdown, bumps or bruises or lesions. And your skin does look clear, dry, and intact. Okay. I'm also going to assess for popliteal at this time, so I'm just going to feel under your knees. You can go ahead and relax for me. Okay, very good. Can you bend your knees up for me? Get them in a 90-degree angle, okay? And can you lift each leg independently? Okay, very good. Okay, you can straighten your legs. Okay. Can you point your toes, pull your toes to your face? Very good. And can you push against my hands, point? Good. Okay. So I'm assessing the skin turgor. Okay, it's non-tinting. I'm looking for any edema. There's no edema. I'm going to check for capillary refill, but since her toenails are painted, I'll go to the back of the toes. Okay, and it is less than 3 seconds. Okay, I'm also going to look at the bottom of your heels. I'm assessing for skin breakdown. Okay, looks good. Okay, And I'm going to go ahead and feel your dorsalis pedis pulses. Here and over. Okay, they are present and they feel like +1. And then I'm going to feel your posterior tibialis pulses. Okay, present and +1. Okay, Miss Williams, can I have you roll to your side? I'm just going to assess your backside. Just have you roll over towards the railing. Okay. So again, I'm going to assess the skin on the back. I'm assessing for any breakdown, skin integrity here. Okay, I do not see any skin breakdown. Okay, you can roll back towards me. Okay. And do you ambulate independently?
Yes, I do.
Okay, so I'm going to lower the bed, and I'm just going to have you just walk across the room, okay, so I can observe.
At this time, as Poppy is lowering the bed, she would also grab non-skid socks, so when the patient ambulates, there is no fall risk.
Okay, so I'm going to make sure you have your socks on. Can you stand, please? Okay, and can you please walk to the... Okay, and I'm assessing your gait right now. Do you have any weakness with this?
No.
Okay, you feel balanced and everything?
Yes.
Okay, very good. You just come back. Okay, Miss Williams, thank you for letting me assess you. I'm gonna go ahead and document. Okay, Miss Williams, do you need to use the restroom at this time?
No.
Okay, would you like to lay back in bed?
Yes, I will.
Okay, can assist you with that. Okay. Are you comfortable, or do you want the head raised just a little bit?
Just a little.
Okay.
At this time, Poppy is making sure she gets all 4 P's in check before she leaves the room.
Okay, are you comfortable?
Yes.
Okay, so I'm just gonna get you your call bell. Here's your call bell. You call if you need anything. Do you need anything at the moment?
No.
Okay, so I'm making sure the bed is in low position. Okay, and the bed is locked. I'm gonna remove my gloves and wash my hands.
Prior to leaving the room, Poppy is going to reassess pain, administer any pain medication if necessary, and ask for any known allergies.
Okay, Miss Williams, I know you said you were in pain earlier. Are you still in pain?
Yes.
Okay, how would you rate that on a scale of 1 to 10?
About a 5.
Okay, and can you show me where that pain is?
It's right here in the lower part.
Okay, and can you describe it for me?
This is sharp pain.
Okay, I know you have hydrocodone order. Do you want me to go get that for you?
Yes, please.
Okay, that'll help with your pain. Do you have any allergies?
Oh, no allergies.
Okay, well, I'm gonna go get that. Let me get your call bell. Okay, and I will be right back, all right?
Okay.
Okay.